Good
Cool.
morning to all the early risers. Yes, we're way too excited at 7 in the morning. And welcome to the very first session of our very first ever big day of training here at Compression Care. Wow, thanks a lot. We have over 400 people signed up to participate in sessions today, and we just couldn't be happier. We're so glad to share on so many topics with you today. And we're also going to be hosting a Microsoft Teams virtual lounge kind of in parallel all day, where you can pop in whenever you have a question, you just want to hang out, you want to meet some people. We'll provide that link to you in the chat here, and we'll remind you about it again at the end of the session. We've got Q&A running in the chat throughout, so please make sure and just ask your questions. We're going to try and tackle everything as we go, and we'll have extra time at the end just to make sure we hit everything. And then, of course, we'll continue over in the Microsoft Teams virtual lounge if we run out of time over here. So we are going to roll right into it. We're sharing 10 hacks today, but basically we're just trying to show you ways that you can save time for yourself and make sure that your patients get to take advantage of every way we can make their experience better too. And it all starts with some awesome new features we've launched now that Compression Care has the added synergy of CompressionGURU.com. And you'll be among the first to hear about some of these this morning, and I'm excited to get your feedback once you've had a chance to try a few of them. Think of it like a bicycle made for two. Here at Compression Care, we've now got Compression Guru riding in the back, and it's opened up some cool new ways that we can help you and help your patients. So let's just start at about a 10,000 foot view first, and then we'll get really granular and start rolling through these hacks. Our philosophy here at Compression Care is to give you control over the things that are important to you and try to save you time and effort on all the rest of it. That means we're trying to meet you where you are and give you lots of options whenever we can. As you probably know all too well, insurance billing has a lot of must-haves. And we've quickly built one of the largest nationwide networks of lymphedema therapists by really thinking as creatively as we can about that. And if you just take a minute to imagine, excuse me one sec, if you take for as many people as we have on this session and throughout all the whole day today in Big Day of Training, there are just about as many personalities and styles. So take a minute and just think about where you fall on this scale, and then we'll show you how you can hack our systems to get what you want. There's no wrong answer to where you are on this scale, but what we find is that on one end of the scale, there's therapists who prefer to be involved in every detail to make sure that it's all right. On the other end of the spectrum, people who would just rather hand it off and be done with it. And most people fall somewhere in between those extremes. But wherever you fall, that's why we're trying to give you control over the things that are important to you, because what's important to you might be not important to someone else. And really just try to get it to where you can maintain control of the things that are important for you to control and let us handle as much of the rest as you're willing. So we'll talk about that. Here's just some of the ways that we're doing that. There's no one way to submit patient referrals. The people ask us, what's the best way? The best way is the way that's best for you. And so we've created our Peace of Mind portal, and hopefully you've had a chance to experience that at this point. That's the fastest way to get a patient into process, but you can still fax or email, and we have a lot of people who do that. Nothing wrong with it. We're developing technology to help us process those faster, and you can still submit via our website. And more, we're creating custom integrations with the software that runs your clinic or your hospital system. We're putting a lot of time and energy into having a tech team that can speed up the transfer of information between you and us. So if you're interested in a custom integration, that's the first hack. Just let us know what software you have, and we'll look into it right away. And let me get back to the Peace of Mind portal for a second. Most referrals there take less than 5 minutes when you use the portal. And you can now use the portal to make self-pay referrals too. That's hack number 2. It's tied to Guru. So you just submit the patient contact information, select the items you want to buy, and hit go. We do all the rest after that. We've got a dedicated in-house rep. Her name is Judy. Patients love Judy. And she helps them either buy it on the website or buy it over the phone, whichever is easier for them. And here's where having Guru in the mix can make a huge, huge difference. Hack number 3, you can create an account on the Guru website and excuse me, and request special status as a medical professional. That will turn on our new cart to quote feature. What that means is you can put items in a quote cart and then submit that directly to your patient so they can purchase those items. Your quote also submits to the lovely Judy at Guru, and so that she can spearhead follow-ups with the patient. You get a confirmation back that says your quote's been sent, and you'll know whenever the patient follows up. It's very cool. And that feature, we've been testing the last couple of weeks. We're getting such positive feedback on it. I think that a lot of people are going to find that really, really useful. We'll give you a link here in a bit so that you can follow that up and activate that feature for yourself. Another new Guru feature can work in combination with cart to quote. It's called custom shop, and that's hack number 4 today. We'll build a custom storefront, either just for you or for your entire clinic, that only shows the products you want. And here's the coolest thing. This is hack number 5 about custom shops. You can create bundles of products that show up in your store. For example, maybe you have a bandaging kit, you have an arm kit, a leg kit, and you're typically sending patients over to purchase all the various items in that kit. You can take that list of bandaging supplies and you can bundle it and give it a name. It can be, Teresa's arm kit, or it could be name of your clinic arm kit, name of your clinic leg kit. And you just give it a name and the product bundle will show up in your custom shop. And then you have 2 options. You can send the patients to your custom shop and they'll see only the items you want them to see. Or you can go to your own custom shop and then take anything that's in your custom shop, create that quote cart, and send it directly to the patient. I'm losing count on how many hacks we've done so far, but I think that another way that we're giving you control over the things that are important to you and saving you time and effort on all the rest is owning more of the process of patient referral. I'm often reminded by therapists, and Josh and I hear this all the time, that we're the ones who get paid for the at-home stage of treatment, the at-home maintenance stage. And you're absolutely right. So we're trying to meet you at least halfway, often much more than that, in becoming part of in absorbing more of the burden of that. And it starts with benefits verification. In the past, whenever we were out of network, we put the whole thing back on you to find someone who is in network. And so hack number 6 today that I'm sharing is that we're one of the charter members of the new Compression Dealer Alliance. And that's allowed us to create an industry-first care coordination network. So now, when you send us a patient and we're not in network, that's okay. We'll find you a billing partner who takes that insurance. So there's no more guessing about who takes what insurance. You just send it. And Ross Gardner, who is our director of patient intake and care coordination, he's working with our billing partners to build an extensive database to help everyone save time. So when we are not in network, we will make sure that we find somebody who is in network with that patient, if anybody is. There are plans out there, particularly some state Medicaids, that just can't be billed. And so it doesn't eliminate a situation where a patient is not able to be billed, but it often is a great solution, so that if we're not in network, you don't have to do the work of figuring out who is. Make sense?
Stephen, there's a
Yeah.
couple questions that have come in as you're going through this
Oh,
too.
let's do it. Yeah.
Megan has asked, is insurance able to be billed with cart to quote? And
Yeah, so we
take-
have a cool feature in Cart to Quote where you can, when you're providing the patient's information, there's a little checkbox that says, please, I forget exactly the wording, but it's like, please check the patient's insurance benefits. And if you check that box, what will happen is Judy will coordinate with our benefits verification team over at Compression Care, and she will work with the patient to, if it's urgent, she will get like one self-pay quantity going to the patient while she's checking benefits and figuring out if we can do more. Or she will just hold the whole thing until we can get the benefits part figured out. And that'll be up to you and the patient, how we proceed there. But if you want, but if you believe insurance may potentially be involved and be helpful, you just check the box, and then Judy will be proactive about that. We're also being proactive about it in general. If we see that it's an item that probably should be covered, depending on the patient's insurance, we're asking the question, like, what is your health insurance? So we're trying to be kind of partners in paperwork with you in that regard.
Yeah, for sure. And another question that just came in too is the usual time frame from sending an order to verification and delivery. And honestly, we get this question all the time because in our industry, it over the last couple of years, this became a major issue, and a lot of companies slowed down.
Particularly when we all got swamped after
Yes,
LTA
no,
implementation. Yeah.
that's exactly right. If you go back to June of 2024,
Oh,
everybody
yeah.
was just
Woo!
absolutely
We were
destroyed.
running I think we were running 3 weeks then.
Yeah, yeah,
That was a lot.
absolutely. And some other people were out there were running months to get something
Yeah,
done.
yeah,
And the
yeah.
crazy thing about that whole 2024 is that when it rolled through, all the therapists got really busy as soon as the LTA passed, and they got really busy, and then it rolled into the DMEs getting swamped around June, July. And as we were trying to pull out, then you get towards November and December, and even the manufacturers got behind. There were back orders, there were all kinds of stuff, which pushed it even further into 2025, or before things actually started smoothing out a little bit. Right now, if you send us a referral in, if you use the portal, it's the fastest way. And I know Steven's going to get to this here shortly, but if you use our portal, it is the fastest way because it goes directly into our system. But you can still fax and email and everything like that. But when it comes in, our benefit verification team is typically running about 3 days to a benefit verification from the day you send it to the day they get it out to you. And recently, we've just made improvements to our benefit verification team. We've brought on a couple new people, and I hope to have that even faster. So hope to have it to 48 hours. So you'll
Yeah.
get a notification that we received it. You'll get a notification that the benefits have been done and what those benefits are. And then it's moved over to a case manager. And now this is where that time frame can be as short as you and the patient make it, or as long as you and the patient make it, because it really comes down to, if you send everything and the patient's covered at 100%, our case managers can be placing that order. If we're missing something when the case managers get it, they have to go get it. They have to go find that. We're
And this
waiting
is
on the doctor.
this would be kind of let's call this a bonus hack, because we didn't plan on
Yeah,
saying this, but when you and we are, I guess we can talk about this. We're about to launch we're calling it just a rack card, but we're going to be sending all of our active therapists who are referring to us. We're going to be sending you it's kind of a trifold brochure size, but it's not a brochure. It's just a little one card. And that card is designed for you to just keep them in the treatment room and hand the card to the patient, so that when you're referring to us, it's just a what to expect, next. Here's how this works. And it's designed to explain to the patient, here's what's going to happen next. Here's who you're going to hear from. Here's the steps in the process. And it's an opportunity for you to tell them like, hey, when these people here, they're going to contact you, and when they do, it's important that you respond quickly and that kind of thing. And so you're going to be receiving those sometime next month, and then there'll be a mechanism so that anytime you're running out of those cards, you can just request more.
Lauren asked too if the patients would actually get updates as we're going through this, because I know I was talking about updating the therapist, and I answered her on here, but I want to just go ahead and tell it for the whole group. She said, "Do the patient gets the same? Does the patient get the same updates as we do?" And the answer is yes. The best way to ensure that though is when you send us the patient's demographic sheet, if you can send us their email address too, it speeds up notifications, because a lot of times patients will not answer phone calls from us because it's a number they don't recognize. I mean, it just happens, right? We all do that. So
that rack card is designed so that it's got a QR code on it. And what I would encourage you to do is when you give the patient that rack card, while they're still in front of you, make them hit that QR code with their phone, because it launches a contact that they can then save, so that when we call them, it will show up as compression care, and it won't just be some random number that they don't recognize. And what we have found is that when people put us in their phone, and it kind of makes that connection, we're much more likely to get through. And when we text them or anything else, it identifies us so that it just does a better job of connecting the dots and reminding them, oh yeah, that's those people that my therapist said we're going to call. Is that good? Did we hit it all?
Well, we actually had a few other questions come in.
Sure.
So I'm just going to roll through it as we're going. Are faxed and emailed orders, when they're sent in, do they pop up in the portal as well? The answer is yes.
Yes.
Absolutely, they'll be in there. Our team manually inputs that and gets it all in. They will pop up. They won't pop up quite as quickly. If you do it through the portal online, it's less than 24 hours that they will pop up. We do have to review every order that comes in and approve it, just to make sure that it's not a duplicate patient or something like that. So even the portal has a slight delay, but if you fax it or email it, the fax and email teams have to get that information in the order it came in, enter everything, and then it will pop up on your portal. So
you'll see it within, you'll typically see it within a business day or two. And then it'll, as the status updates in our system internally and it moves through our processes, you'll be able to see that that's happened. So you'll know that it's like at a benefit verification. You'll know that it's at, we're waiting on the patient to get back to us. You'll know kind of where it's at and what step is being pursued.
Yeah, and we've got a lot of people saying, thanks so much for building that rack card. That's a great idea.
Oh, yeah.
We'll get that out to you as soon as possible. And then can you change the layouts of your patients to show the latest patients first rather than the older ones? The answer is yes to that. We don't actually have the up and down arrows, but every one of the columns across the top actually does have the up and down arrows. You just can't see them. I think we're going to have to make them.
If you click on the header, it will sort the entire thing based on that column. And if you click it again, it'll sort in the reverse order. So it's like newest, oldest, A to Z, Z to A, that kind of thing. And we're getting great feedback on like questions like that. And we have several people on our tech team who are full-time working on improvements to the portal. And some of those kind of cosmetic things are they go into a queue and get tackled. So yeah, we'll I believe we already have that on the list of improvements, but pending. But we'll make sure it gets added in there for you. Because if you use it every day, and there's we'll talk about this a little bit more at the end, but anytime you have a suggestion like that, we love those because we just pass them along and it gets somewhere on the product roadmap for development. So go ahead. You got more?
Sorry, there is one more that I just want to throw in there.
I'm 7 in the morning. Really glad no one would be awake yet.
No, right? Peyton, I'm really glad you got your volume back. That's hilarious. Why the reasoning there. As far as can we get an email letting us know when things have changed or been updated in the portal? So typically what we have is when our case managers are actually making a change or they need something, they're going to they're going to send a message through the portal. That portal is going to send you an email of that message. It is also going to drop that message that they wrote into the patient's chart. So if you go into the portal, you will actually see a little mailbox icon with the thing up, and it'll have just like your mailbox on your phone. It'll have a little red number there. It'll say 1, 2, 3, however many messages you have. So you'll actually be able to see the notification. When we change statuses, it does not necessarily send you an email though. And I don't know.
It's there's some people who want more notifications and some people who want less. So we do have it on the product roadmap to make that kind of a setting that you control, so that at a certain point, you're going to have more control over how often or how never you get updates. And that is on the product roadmap. It is not there today. Since we launched the portal, and actually we launched, kind of major updates to it in November, we were overwhelmed with feedback, and we have the product roadmap is quite robust right now. We have a lot of things on the list.
And just one thing about that little, I'm sorry, Stephen, I'm doing it to you
No,
again.
go ahead.
You've got a presentation to get through. That little mailbox, when you click on that mailbox, we went back and forth a little bit on whether to put the newest messages first or the oldest messages first. We went with oldest messages first. And so and you have to scroll down in the box that comes up to read the newest message. I really thought about changing it, but then I realized that if we put the newest messages on top, you would see the newest message, but you might miss one underneath that for something else we needed. So we left it so that you do have to scroll down through the messages, but they are date and time stamped. So you can see like, oh, this is way old, and kind of know where the new message is in there. But when you click on that little mailbox, it'll pop up. Just scroll down on that box, and you will see all of the messages that we sent to you. So
I've never seen this many comments in the comments box. This is
I
amazing.
love it.
All right. So hack number 7 relates to this synergy we now have with CompressionGURU.com. It allows us to offer our exclusive lowest out-of-pocket cost guarantee. And so I want to just kind of run you through this. We're really trying to be aggressive about affordability. Whenever a patient's out-of-pocket costs exceed the cost to buy directly from Guru, we'll offer that automatically. So you never have to wonder if the patient is paying too much. It never will happen with us. Okay. Hack number 8, Guru sells almost everything at what's called MAP, or minimum advertised price. That also means you shouldn't have to shop around for the best price, because we're selling at the lowest retail price allowed by the manufacturers. Okay. And sometimes a price change will take a little bit of time to work through the system and update. But in general, we're being really diligent about making sure that we are matching the minimum advertised price allowed by the manufacturer. And that's an important thing to know, just because you don't need to spend all your time trying to figure out how to save patients money. We're doing that for you. And the way we treat the synergy with Guru is that, obviously, well, maybe not obviously, when we can serve your patient using their insurance benefits, patients almost always opt for more garments, more and different garments. So they will tend to use more of the tools that you're making available to them for at-home maintenance. And the more options they have, the more likely they are to be compliant. When insurance benefits are falling short, Guru becomes the safety net where we can serve that patient and find the right balance between what is affordable for them and what they need. And we are, I'm going to take you through several things we're doing now that are really designed to help with this affordability question. Affordability, we've done 2 things to help patients with affordability. Besides the lowest out-of-pocket cost guarantee, payment plans. So when we're working on the compression care side, payment plans, the patient can opt to break their out-of-pocket costs into 3 equal monthly payments. Okay. And our case managers are trained to help them when they express any concern about affordability. That's an immediate option available to them. And we've also introduced, if you're on the self-pay side at Guru, we have now partnered with Klarna, Affirm, and I think one other one that these are options that are readily available to anybody checking out on Compression Guru, where you can break the cost of the purchase into, I believe it's with Klarna and Affirm, it's like 4 payments, 4 monthly, 4 month. It's either 2 weeks or a month, but it lets them build a plan that spreads the cost out over a more reasonable amount of time. And a very common one is if you have, say, an elderly patient who's living on a fixed income, this allows them to kind of budget this in a way that's more absorbable for them. And, our mission is to make high quality compression care more accessible, affordable, and convenient, no matter where anybody lives. And so this is one of the sort of underpinnings of our business. And so payment plans is something that we've been working really hard to make available on just about any front. So there's nothing the patient's going to buy, whether they're buying it with out-of-pocket costs with their insurance, or whether they're buying it straight up at Guru, they're going to have the ability to break that into payments. We've also added, in situations when affordability is really a problem, we've now added our cost assistance program to offer even more help. This is something we've been doing for, many, many years at our sister company, Pretty in Pink Boutique here in Nashville. And what it does is it allows us, when we have a patient who has been really active and participating well in their treatment and gives every indication and commitment that they're going to do the at-home maintenance and they will use the garments, the cost assistance program will step in and cover up to half of those costs, depending on the situation. And so our case managers are trained so that when somebody is saying they can't move forward, and affordability is the issue, but there's every indication that the patient is being real active participant in their care, they are trained to be able to then activate a request to the cost assistance program, and it gets reviewed very quickly. Patients don't have to submit tax returns, financial info. It's designed to be really, really, really simple. And so that's what we're doing on our end to help patients when they express concern about affordability, to make sure that they don't have to forego care. Because honestly, if there's no point in you taking them through the whole entire treatment process for them to just ignore their at-home phase. And we understand that, if they don't begin this at-home phase, they're just going to end up back in treatment. It's a revolving door at that point. So we're really trying to make sure that they have access to this care. It's just really important to us and to Pam and to us as founders, and it's just something we feel strongly about. Okay, so hack number 10. Documentation. Back to the criticism some of you have shared over the years that we're the ones getting paid for the at-home phase of care. You know that, we know that, everyone knows getting the documentation gathered is the most time-consuming part of this whole process. It's the bottleneck. And we're the first, I think maybe only national biller who isn't putting this entire burden on you as therapists. We're calling it Partners in Paperwork. And it's working. It's not taking it over from you. It's not leaving it all on you. It's somewhere in the middle, and it's working together to save each other some time and effort. And so think of it this way. We've added, I lost my spot. Here we go. Sorry. We've added some dedicated document retrieval specialists to our team. They're assistant case managers who work with the case managers to track down documentation that may be missing from patient referrals. Some of you prefer to get the RX from the referring physician, and we love that, obviously. That's awesome. In fact, when you have a great relationship with the referring physician, MD, RN, DO, PA, it's much more likely that they're going to respond to you faster than us. But in situations where that presents an extra burden to you that you don't want, just give us a good head start. Point us in the right direction with solid contact information for the referring physician, and we'll take the lead on the RX. It's really win-win. It saves you time, and when we do it, we're using our preferred format, and we know that paperwork is going to hold up to Medicare audits and such. And we believe that Medicare audits, audits, and not just with Medicare, but across the board, it's clear that we're going to be seeing more and more emphasis on documentation to justify these costs. So I think that it's just an important way for us to partner and to work with you. Here's the main thing we ask. Just don't say that the doctor is John Smith and leave it at that. The NPI database is huge, and there are like tons of docs with the same name. Also, the NPI database is just notorious for having terrible contact information, outdated numbers. Like, it gives you the generic number for a hospital system instead of the doctor's office specifically, things like that. It gives you some generic fax that goes to the records department and not to the doctor's office. So please give us everything you've got from the physician, so in terms of contact information, so that you can save us as much time as possible getting in contact. And if you'll do that, then we say fair enough, and that's a huge hack right there. We can save you a lot of time if you find getting prescriptions to be an added burden. We can work together on that, and we'll try to save you some time as long as you'll hand it off to us in a way that we can do it efficiently.
For sure. There's a couple questions that have come in.
Sure, there's a million questions
just
about
kind of
that.
regarding this.
Yes, we will get the RX.
Yeah, we will.
Like 80 people who just asked that question.
How specific does the referral RX need to be? And so what we typically do is, if you've sent us the order, we're actually putting the exact garment that you're ordering on that prescription. That seems to be the best way.
Yeah,
go ahead.
definitely.
Okay.
No,
okay.
I mean, here, bonus hack. Okay. Bonus hack. Order tracking. We're spending a lot of energy making it so that the Peace of Mind portal, we call it POMP, lets you track all your referrals. We've talked about, your questions on how to maneuver the dashboard there. But when you log in, you can see all your referrals, and we're constantly adding access to new information there. So as products ship and we get tracking numbers, we're making that information available, and your view of the order and the order status, and particularly the shipping and delivery status, is going to be improving dramatically over the coming weeks, because we've been doing a lot of work on that front. And we've got it to the point now that when the manufacturer ships the product, they give us a tracking number. We're now taking that tracking number, and our systems are following that tracking number at FedEx or UPS or wherever it's from. And whenever UPS or FedEx, whenever the shipper gives us updates, then that's getting reflected into the system. And so that access to additional shipping and delivery information is going to get very robust going forward. And I think it'll just keep getting better and better. And so if you're not using the portal yet, please jump in there and make sure you have access. Your work email is your login. And there are some self-service features. If you don't know your password, you can reset it and it'll send you an email. You can just let us know. The customer service team can help you get in there. They do that all day, every day. So it's important to get in there. And you'll also, if you haven't used the intake there, what is also really cool about the patient intake in the portal is that if you're missing any piece of the puzzle, let's say you don't have a prescription, you can tell us how we want to get that. You can either say, I'm going to send it later, or, hey, call my office and get it from Julie in the office. Or you can say, here's the contact, here's the doctor. Can you take the lead on that? And if you have it separately and you're going to fax it or email it later, you can do that too. You just tell us how it's coming, and then our team, our document retrieval people, will follow up and make sure that we ultimately get it and put it in place so that we can move forward. It's really critical that we have all these pieces together so that when we order, we can know that insurance is going to pay. And so just keep in mind that it's kind of like we're putting pieces of a puzzle together here so that we can then move forward. And whether that takes a couple of days or whether it takes 9 days or even longer depends on whether these people all do their part. And we're bringing we got to land a lot of planes to get.
For sure. We're balancing between what the insurance companies are requiring and what the doctor will give us and what you can give us and what the patient will give us. Mary actually has a good question on this.
Sure.
Can you send us a template of what information is needed?
Yeah. We have we have RXs. We have our own form that we actually prefer because it addresses a lot of the. It's designed to survive a Medicare audit, which is the most stringent audit so far that we would receive. Yes is the answer. And you can request those from any case manager. You can request it from Josh. Josh's email. Just put it.
Drop that in there.
Put it up there, and you can email Josh, and he can send you these. We also have what we call our quick version, and there's a lot coming down the pipe. We'll talk about it in some other sessions, particularly the session this afternoon. That's the last session of the day. There's going to be a lot about what's going on with the Medicare audits that all billers have been receiving during the second half of last year, and we're going to be sharing a lot of material there.
Sure.
So let's wrap the presentation and then make sure that we're hitting all the questions that we have in here.
Yeah, we've definitely got a bunch more. We'll wrap up the presentation. We'll finish up with some of these questions here.
And this is just more, we work on feedback and we take every piece of feedback. We can't act on everything right away, but we do take it into consideration. And so you have an idea for a feature, whether it's in the portal or any other aspect of what we're doing, just let us know. If we can remove friction from any process, let us know. And if we can do it, we will. And I'm really serious about these custom integrations. The people that we've done this with, it really simplifies their lives. And particularly if you're on a system like Epic or there's a handful of them that Kronos, there's a handful of them that we are now developing really good experience with. And I think we can, help make these really work to where, fewer and fewer steps on your end. And I think custom integrations are ultimately going to be a great way to help save time and effort on your end and just find the most efficient ways to get information out of your system into our system. And we've expanded the support team. The CompressionCare team, Ross, Rebecca, Reba, Madeline, there's more names that I haven't put on here. They are always available. We use a lot of technology here, but we use it as a way to enhance the efficiency of our people, not replace people. So, you can call 583-CARE. You can email support compression care. You can bug Josh. You can do whatever you want.
Absolutely.
And
I'm here.
I think that and they're ready to help. And you can initiate any of these things with them, and they will and they'll jump in and help you out. Here's how you can access all the cool new Guru features: the cart to quote, custom shop. We're going to put a link into the chat right now. I'm gonna paste it in there for you. And this is a landing spot where you can. Hopefully that worked. No, it didn't. Hold on, I did it wrong.
While you're doing that, I'm going to answer one of these questions from Lauren. She says, if our scripts state refills of 99, but quantity of 1, why do I have to submit another script for the second set? So this is an insurance thing. Honestly, the best way to do that, let's say that I'm assuming that you're going to order 1 for fit, and then you'll want to get a second or third set using that script. Because daytime garments, you can get 3 every 6 months. So the best way to do that is to either write max and refills of 99 or 3 and refills of 99. The reason I like writing max is because there are some insurance, the commercial insurance, that with the right diagnosis, the patient can get 4 or 5 or 6.
Yeah, 3 is not the limit.
Yeah, 3 is not.
3 is Medicare's limit, but it is not a strict limit.
Correct.
Yeah, for
so
sure.
Yeah, so that's why I like writing, max quantity, refills 99. The refills, honestly, the 99 is just a way. It's just a way to move it through. The script is actually good for 1 full year. So, but it's best that we can use that 6 months later when the next quantity, we can go, okay, they got 3 at the first time. Now they get 3 at the second time. So the best way to do it, if you want just 1 for fit, is to write it max and 99, and then just put on your message to us, order 1 for fit, and we will order 1 for fit. And then we have a status in our system that's called follow-up fit. So our case managers will actually drop that patient into a follow-up fit status, and 30 days from the day that they ordered this first garment, giving them time to get the garment, try it on, wear it, wash it, wear it, love it, they'll reach out. And if the patient says yes, and if you say yes, and everything fits great, then we're going ahead and ordering those other quantities.
Well, and since you brought it up, 1 for fit is we prefer just order the max. And if it is ready to wear, just order all 3, because it's just as easy for us to return 3 as it is 1. And it's only 1 shipping cost at that point, because the shipping cost comes out of our end. And so it costs us a lot of margin, and margin is becoming, really, really thin. It costs us just as much to return 3 as it does 1, but it costs us double to ship 1 and then 2. So just if it's ready to wear, just do them all at once. It's no harder to return 3. If it is custom, order all 3. And what we will do is, because then it's also 1 interaction with the patient. We don't have to get the patient to pay the copay on 1 and then come back and get them to pay it on 2 more. We can do it all at once, and then we will ship 1 for fit. And then as soon as we know that, as soon as we have the feedback that it's correct, we'll ship the other 2.
That's exactly right.
And then we bill it correctly, but getting the commitment from the patient all at once just removes a whole nother step in the process. So we have a cheat sheet that we're doing. We're giving out 4 really cool cheat sheets today. One is garment selection. And on that garment selection, we talk about that. So when you get to the resources, this QR code, guys, will take you to a page that will give you all the follow-ups for this session and all the sessions today. You can see the slide decks. You can see the cheat sheets. You can see you can get the certificate for your time that you can submit to your accrediting body. So you'll be getting an email tomorrow that has this all. So don't panic if you don't get it right now. But just to run through, we're running a little short on time, but I want to make sure we hit all these epic smart phrases. Yes, we can do that. So if you're interested in that, just let us know, and we will we'll get it on the roadmap. Julie, your scripts are great. Don't change a thing. If we need anything different, we'll certainly let you know. Tina, state insurances, specifically Medi-Cal. We will do me a favor and send Josh an email about that one, and we'll have our benefits verification people figure out. I know we don't, but we can figure out who in our care coordination network does, and I believe we have at least one that does, probably two.
Sure. Probably two.
Medicare accepts scripts for garments from OTD or DPT. No. You can create the script, but it has to be signed by an MD, a nurse practitioner, a DO, or a PA. Those are the only four that can sign the scripts. Let's see here. A second set of garments on the portal. We don't have it set up to where you can reorder automatically things that you've ordered previously, but we are very, very close to having it to where when you select a patient, it will let you choose things that you've previously ordered. That is in the works.
That step is really close to being done. The reorder button, we're going to work on not only a reorder button like, hey, it's been 8 months or 6 months or whatever, and I would like to reorder this garment, but we're also going to make that reorder feature where it's like, I just want a quick little, like, I want the other 2 garments. That button is really high on our list of things our IT guys are doing. It's going to show up, and it'll be my vision for that right now is that it will show up when you log into the portal and you see the little eyeball icon and the little lines, 3 lines and all that. It's going to show up right next to that, and you will see that reorder, and then you'll be able to select what you're reordering and why you're reordering, and it'll just make it super fast and just click right through.
Bikash, system does not work in Canada right now. We are in talks with the ILF there to try and figure out a solution to that. It's not going to be a quick answer. Just based on the biggest challenge we have right now is not everything is available in Canada because it's all different distribution than the US, and they just don't have the same kind of drop shipping infrastructure set up there. So, but it's something we're working on. It's a longer term project, to be honest.
Yeah,
Lauren.
Yeah, it's the best way to say it. Gosh, we're working on it. We're working on it as we go, and
we have a lot of demand.
I'm
sorry we can't. Yeah, I'm really sorry we can't meet the demand for Canada right now. Mary June, yes, we have templates for everything. So email Josh and he will give you everything. But when you get into the resources page, and you see these cheat sheets, it might give you a lot. We're providing a lot of guidance on plan of care, and it's really hard to nail down a plan of care template that works for everybody. But we're providing some sample wording for certain situations, and I think that that'll get good. How specific does the referral? Does the RX need to be? I would encourage you, Geraldine. You can get our prescription form either off the website or just ask Josh for a copy of it and we'll get it to you. It covers all the bases, and it doesn't have to be specific about manufacturer and style, but it does need to be like, ready to wear arm sleeve or custom arm sleeve, and in the situation of, and it does need to specify, the compression level, things like that. It's all laid out really clearly on our samples. Let's see. Anything else? Anything you think we missed? The link to
Jacqueline,
the
I did.
portal.
Yeah, I did put the link in there.
The portal is compressioncare.site. Compressioncare.site. Okay, I hope we didn't miss anybody.
I think we kept up pretty well. I think we got
All right.
everybody. If not, please send me an email, joshua@compressioncare.com. That's fine.
Yeah.
I know too that
I'm
some
gonna
of
leave
you are
you
probably
I'm going to leave everybody with the link over to the Teams. So we have a Microsoft Teams virtual lounge. It's going all day. We have staff members over there who are able to answer questions, point you in the right direction on stuff. You'll also be getting an email tomorrow that brings you to the resources page. So if you didn't get a chance to get all that here, no worries. And the Guru team is also jumping over there at intervals into the Teams lounge. So if you need help getting your account set up at Guru so that you can use the cart to quote feature, if you're interested in a custom shop, here is the link to that again, just to give you one more shot at that. And I apologize. Josh is a tyrant who booked me like basically every hour all day. So I have to move over to another session, but wow. Thanks for your participation.
For those of you who have signed up for the next session, thank you. We'll definitely see you over there. We really appreciate that. The couple things that I wanted to just point out real quick that I was sent a message from someone that was on the meeting here is that as a biller, we have to walk that fine line of coaching. But a manufacturer rep can get very specific and speak more bluntly sometimes. And they have the ability a lot of times to provide a more accurate example of notes that you should put in your POCs and such like that. So any practitioner out there can, or clinician can
and we've got, we've got really big news coming out of these Medicare audits and how it's going to affect everything. So going forward, I'd strongly encourage you, if you can either attend the session this afternoon at 5 Central or sign up for it. And if you can't be there, you'll still get alerted so you can watch the video after the fact. We're going to be giving out some really useful information in that session.
One other thing that was pointed out, and I apologize for doing this. I meant to say it myself while Stephen was talking about the ordering 3 there. A lot of the manufacturers have actually come to us and asked that, and this was actually a manufacturer sending me this, but a lot of the manufacturers have asked that we do order all 3 and that clinicians order all 3. And the one thing
it's more efficient for everybody involved. And
and if Medicare set that as this is what they want us to do and we don't do it, they can always take it away. So keep that in mind too. So I appreciate you guys. I'm going to jump to the next meeting.
So excited to have you with us, and I hope we see you again elsewhere in the day-to-day. And thanks for being part of Big Day of Training. Thanks for working with us. Thanks for all you're doing for patients. We're doing our best to be a great partner, and I hope that it just keeps getting better and better. And I head over to the Teams Lounge, meet a couple of our folks. And if we didn't get to your questions or you feel like you need a better answer or more of an answer, just let them know. And they have a whole mechanism to take down questions and set up a follow-up, and we'll do it in the next few days. Thanks, and we'll see you soon.